Hi, in this video, I'm going to be talking about tamoxifen and depression or other mood changes. Before I do, I'd love to invite you to subscribe to our channel. This topic we're covering because we've had many comments and questions about mood changes related to tamoxifen. Tamoxifen is an endocrine therapy or hormonal therapy that's used in people who have hormone receptor breast cancer. It works in both pre- and postmenopausal people and is used for prevention of breast cancer in people at high risk, as well as treatment of breast cancer. I wanted to take a moment to talk about why we really struggle to understand quality of life side effects in tamoxifen in particular. Tamoxifen is the first targeted therapy we ever had. We've had this drug for 40 years. When the original trials were done, there was very little information collected on quality of life. Really, the endpoints were disease-free recurrence and overall survival, what I call oncovision. It was all focused on the cancer outcomes. Was tamoxifen helping people with cancer? And there were no surveys done or information collected from those study participants on how are you feeling and what other organs are affected by tamoxifen. So it's taken us many years to, for example, understand that there's an increase in the risk of retinal problems in people on tamoxifen. It took us 40 years to find that out. So how did we find things out about tamoxifen? Well, tamoxifen, as I mentioned, has been used in prevention of breast cancer in people at high risk. And in the prevention studies, which were done much more recently, we were interested in and did collect endpoints such as mood and weight and other side effects like eye problems and hot flashes, all the things that you know are important to know about when you're on tamoxifen. So when we look at tamoxifen and mood changes, our data are from the prevention studies. And the prevention studies, in particular, the first one, P1, NSABP P-1, was a prevention study of tamoxifen against placebo, which is a sugar pill, if you will. Now, placebos can have some physiologic effects on people's body, but in general, we refer to them as inactive medications. That's not entirely accurate. But if you think about tamoxifen versus an M&M, that's basically what we're talking about, chocolate that's covered in candy, something very small. So people were put on either tamoxifen or placebo. They did not know which one, nor did their doctors. Only the study leaders and staff knew which drug the participants were taking. And in that study, people were followed for quality of life and mood, and as I mentioned, weight and all sorts of other side effects. And that's where we have our information. So what I'm going to say next is a result of these placebo-controlled studies. There is no clear connection between tamoxifen in the prevention setting and depression or other mood changes like irritability. No more than in placebo. So in other words, let's say 10% of people felt blue, sad on tamoxifen. That was the same as people on the placebo. So I'm not saying 0 people had depression or mood changes. What I'm saying is it was 1 in 10 people on tamoxifen and 1 in 10 people on placebo. You will also hear that tamoxifen does not cause weight gain, and that's because people on tamoxifen gained weight to the same extent as people on a sugar pill, and it wasn't a massive sugar pill. It wasn't a huge M&M. So this is why when you talk with your medical team, they may say, we used to think it caused weight gain, but now we don't. They're basing that on the placebo-controlled study. The biggest problem in extrapolating from the placebo-controlled studies to somebody on tamoxifen for breast cancer is that breast cancer is associated with a whole bunch of other things. The disruption in your life story, sometimes chemotherapy, anxiety, other medications that you're on to manage the side effects of breast cancer treatment. For example, corticosteroids, which we use to prevent nausea and sometimes allergic reactions from chemotherapy. Steroids cause irritability and mood change and weight gain and skin problems like acne. So can you see how breast cancer treatment as a whole, including tamoxifen, can cause mood changes, even if the placebo-controlled studies say no more than a sugar pill? Now, something really important to know is that we believe if you are having a side effect, let's say you're on tamoxifen, you have mood changes and irritability and sadness, and you come off tamoxifen and feel better, yes, that could have been a placebo effect. That may have been because our brains are very powerful and our brains and body are one. And in my opinion, this was your experience. Nobody gets to take that away from you. But the large studies of thousands of people say that it's not more common than in people on placebo. The reason I think this is hopeful is because we can use the power of the brain to help us manage side effects. Cognitive behavioral therapy, understanding your thoughts, beliefs, and how you act and feel in your body, can help us sort of disconnect or unyoke taking a medication with a side effect. And we know that cognitive behavioral therapy works for depression. Cognitive behavioral therapy works for people who've had trauma. Cognitive behavioral therapy works for hot flashes. And again, this is not to say it isn't real, but rather that our bodies and brain are not separate. You know, it's sort of Western for us to say it's only in our head. That's not how most of the world sees our body-brain connection. So you know if you are, you smell something and it reminds you of something else, that's your body, your scent, making your brain have a certain memory that can be so powerful. You can have other physical reactions like anxiety or great pleasure. There are many other examples of how our body and brain are so intricately connected that separating them is a false dichotomy. So when we talk about the placebo effect, this is a very real thing. And we can use the power of our brain to manage a lot of these problems that we have related to not just breast cancer medications, but really any medication. Did you know if I give you a sugar pill, give 100 people a sugar pill and say you may get nausea, that 30 of them will get nausea from a placebo? So again, our brains and bodies are so powerful. So what do you do if you're experiencing mood and irritability problems from tamoxifen? The first thing is to recognize it and realize this is a very real thing that you're experiencing. Look at all you've been through. You've been through a major life disruption, multiple treatments. You've had changes in your social support, your structure, your daily routine. All of these things can lead us to feel blue and be irritable. You're on other medications like corticosteroids or chemotherapy. Your sleep is disrupted. You may be having hot flashes. No wonder you're blue and irritable, in addition to perhaps from the tamoxifen. So recognizing it, acknowledging it, and then sharing that information with your medical team. A lot of people want to be so-called good patients. They tell me, I don't want to complain. But if we don't get good information from you, it's hard for us to give you good information and treatment options. You're not complaining, you're reporting your symptoms, if that helps. So in the medical chart, it may say patient complains of such and such. That's very old medical language that we try not to use anymore. The patient reports, she does not have such and such instead of she denies. So report your symptoms to your team. We can make all kinds of changes. I've had something as simple as a 20 milligram tablet switch to two 10 milligram tablets of tamoxifen with people feeling better. I don't know why that would be, but if it works, doesn't cost any more. Yes, you have to take the pill twice a day, but if you feel better, let's try it. You can't have these suggestions made if you don't tell us that you're having them. The other thing is other changes can be made. So if you're not tolerating tamoxifen and you do not have functioning ovaries, an aromatase inhibitor could be an alternative. There are other things that can help. I mentioned cognitive behavioral therapy. I'd love to mention support groups, sometimes feeling less isolated, knowing you're not alone, hearing other people's strategies can be really helpful. There's talk therapy, so there's one-on-one support through a therapist, a counselor, the social worker in your practice. Just let your doctor know. You can even talk with your primary care doctor, your gynecologist. Maybe they can recommend somebody for you. It can be helpful to see somebody who's used to working with people who have been treated for breast cancer because they're more familiar with the side effects of our treatments. And then, of course, sometimes people need medications for depression, and that's something that you and your doctor can talk about. Who's at higher risk from depression related to tamoxifen? Well, if you have a previous history of mood disorders, including depression or anxiety, you may be more likely to notice depression on tamoxifen. We do not see a link between the risk of recurrence or how severe the disease is and the risk of depression, which is really interesting. People who are less active may find that they have more depressive symptoms, as well as people with sleep problems. So as usual, we recommend movement. We recommend being outside. We recommend being mindful. I love recommending that people write things down. I just heard from a friend that they will write things down and then rip it up. So they don't have to worry about, was I a good writer? Who might see this? So you might keep a journal where you can look back on everything you've been through, or you may write things down and just discard them, or somewhere in between. You keep them for a while and then throw them away. They can be really helpful to share with your medical team and with friends and other trusted people. I hope this video has been helpful to you. I've covered a lot. Drop a comment or question below. We try to respond to comments and questions within a week or two at the most. While I can't offer specific medical advice, I can give additional general information. Don't forget to subscribe to our YouTube channel, and you can follow us on Instagram. Thank you for watching.